Hi, everyone. I'm Siobhan Barber. I'm the Communications Director here at Welcome MD, and I'm going to be your moderator for today's event. First, I wanted to say I really appreciate everyone taking the time out of their day to be with us today. I'm sure you heard this event is being recorded, so if you do need to drop off, we can send you the recording after the event in case you missed anything. Just to let everyone know, there is a Q&A button at the bottom of your screen in the navigation menu. Please feel free to submit any questions at any time. If they're appropriate to the topic we're discussing, we can answer them as they come in. Otherwise, we'll just have all the questions at the end that we'll answer at the end of the presentation. Obviously, you're all with us today to learn about Concierge 2.0 medicine. So I did want to take a minute to introduce the team. We have Tara Greenberg, our membership director, who's here with us today. Dr. Melissa McVen, our concierge physician, who's with us today also. And then we have Olga Esparza, our office manager, down in the Naples office. So before we begin, I wanted to take a moment and have Dr. McVen speak for a little bit about herself. So she's going to share with you a little bit about her background and why she decided to leave traditional medicine and move over to concierge medicine with Welcome MD. Dr. McVen.
Hi, thanks, Siobhan. My name is Dr. Melissa McVen. I am a board certified family practice physician, and I initially was in Northern Illinois, and I practiced traditional medicine there for about a year and a half. Then I moved to concierge medicine due to a family reason, but recently have thankfully been able to transition back into primary care. And a big aspect of that for me was wanting to go back to primary care, but not being able to, or not wanting to be in a rushed environment where I didn't have as much time on my patients. So this opportunity to be in concierge care allows me a lot more time with my patients, to have a deeper relationship and a better understanding of their health needs and goals.
Great. Thank you so much, Dr. McVen. Next, I'd like to introduce Tara Greenberg, as she will be presenting our program today. Tara is being a trooper with us today. She's battling a little bit of allergies and congestion, so we'll forgive her if she has to take a break for a sip of hot tea between slides. Tara is a pharmacist by training, but her role at Welcome MD is really as your patient advocate. She's here today to teach you a little bit about concierge medicine, and particularly our model that we like to call 2.0. And of course, answer any questions you might have regarding membership and its benefits. And now I will turn it over to Tara.
Thank you, Siobhan. We're very lucky to have you as our communication director. I appreciate the introduction. So as Siobhan mentioned, I am a pharmacist by training, and I was very frustrated by seeing patients coming in with multiple prescriptions and nobody really getting to the root cause of the problem. Because of a very personal experience I had, I became aware of the differences in concierge medicine and the impact it could have on their patients. And I decided, with all the years that I spent learning how to really help patients, that in my role in concierge medicine as an advocate, I could really do more to impact my patients. And that's why when there was an opening with Welcome MD, I came on board, and it's a decision I've been happy with every day. I'm going to share with you some of the differences between traditional medicine and concierge medicine. I really like this program to be participative, so please ask as many questions. We like our doctors to focus on just patient care. So any clinical questions, Dr. McVen is going to answer, but any questions that have to do with membership, I'm going to be here to kind of support and answer those questions for you. So first off, just the basics is, what is concierge medicine and how is that different than traditional medicine? And one thing I want to kind of take a step back is, what was medicine like and what is medicine like today? Because there's been a lot of changes. And hopefully you can relate to this picture. This is what we grew up with. Kind of the family doctor, the kind of doctor that inspired Dr. McVen to go into family medicine, that we knew our doctor, and our doctor didn't just know us, he knew our family. It was a real relationship. We trusted our doctor, and it had an impact that unfortunately doesn't always exist today. A doctor's office today looks a lot more like this, and it isn't really the doctor's fault. This transition has occurred because as you and I pay more and more in insurance premiums, doctors are reimbursed less and less. and it forces doctor employers to make doctors see more patients in less time. And the people who suffer are the doctors, and more importantly, you, the patients. Because if a doctor doesn't have time to get to the root cause of a problem, they often have little more bandwidth to prescribe a prescription that masks a symptom rather than look at other ways to treat you. And certainly they don't have time to look at preventative care. In concierge medicine, our patients invest in their health by paying a membership fee, and that fee allows doctors to limit the number of patients they have, to have more time with their patients, for patients to have more access to the doctors, and depending on the different practices, to also enjoy a different host of benefits that can really impact their patient experience. So I like to put things in real concrete terms. In a traditional practice, according to a national survey, an average doctor sees between 25 and 40 patients a day. In concierge medicine, doctors see on average 6 to 8 patients a day. It means the doctor has more time with the patient, they have less burnout, they have really undivided attention on each patient. When a patient comes to scheduling their appointment, on average, they have to wait 24 days for the appointment. And what that really means is that a sick appointment may take 2 to 4 days. Now, if you're calling for a flu appointment, by the time you see the doctor, it may actually be too late to get a treatment. And if you're calling for annual physical, it may be 2 to 4 to 6 months before you get that appointment. In concierge medicine, patients enjoy a same day, next day sick appointment, where that's the most important time to see a doctor. You know, if you catch a disease when it's small, we can often prevent that disease from becoming more severe. Once you finally get into that appointment, you show up on time, but you're probably going to wait 40 minutes before you see the doctor. I have a lot of people call me that are busy, they have jobs, they've stopped going to the doctor because they come so frustrated with this experience of waiting 40 minutes for a 7-minute appointment with their doctor. Concierge practices don't double book appointments. So the wait time is usually less than 5 minutes. So I just mentioned you wait 40 minutes in the doctor's office, and then the doctors are only scheduled 7-minute appointments for each patient. That, again, doesn't leave the doctor much of an opportunity to do much more than prescribe a prescription and mask a symptom. Most concierge practices have a minimum of a 30-minute spot for a patient. It allows the doctor to look at the root cause, to discuss more than one thing at a time with the patient, and really develop that personal relationship. We know from studies that if you have a relationship with your doctor, you're going to have a better outcome. So what happens if you have a problem after clinic hours? You're not going to be able to reach your doctor. It leaves you with a little alternative than going to urgent care or an acute clinic or an emergency room. In concierge medicine, in an emergency, you actually have 24/7 access to the doctor that knows you. And in specialist referrals, and a lot of patients in Naples complain to me about this, it's hard to make an appointment with the doctor. If you don't understand what your specialist told you, it's very hard to get clarification, and the whole process is extremely frustrating. In concierge practice, they usually have a team that will help you coordinate that process, make the appointment, make sure the paperwork goes back and forth, and then give you continuity of care after the appointment to make sure that appointment actually has value for you. So that is the basic for traditional concierge practices. It gives you a contrast between traditional medicine and concierge. In our practice, we try and take this to a whole new level. It's kind of a concierge 2.0. Our goal is to help you feel better today and age better tomorrow. And I kind of want to go over those differences, but Dr. McVen, would you mind sharing with us some of the differences that we do at Welcome MD?
Absolutely. So when you come in and discuss our services with me, I like to focus on the fact that we are given more time. So like Tara mentioned, a minimum of a 30-minute appointment. And then our physicals are 90 minutes. It's an hour and a half to review your history, figure out if you need specific screening tests done. And so that's just the baseline from where we go. On top of that, a lot of times I may recommend advanced lab panels, which go into deeper understanding of things like your cholesterol, where some inflammatory factors might be, and just gives us more information about your treatment. I also like to look at where your risks. Is there a family history of something that we should be focusing more on to help avoid a medical problem which would cause you more issues? We do a specialized genetic test, so genomics, to see if you're more at risk for other health conditions or nutrient deficiencies. This also helps me advise you best in the future on how you should train to maintain optimal health in that way as well. And then I always believe in digging deep, figuring out what's really going on, because I am a huge proponent of minimizing medications. As Tara was saying, polypharmacy, many medications, is a huge issue. Not only do you have side effects, but you have interactions of all those medications. So I always like to focus on your diet, your lifestyle, and figuring out what's causing the illness instead of just masking it with a pill. So should you end up in the hospital, it does happen, as unfortunate as it is. I go to the hospital, I visit you. I also help speak with the hospitalist, coordinate care, coordinate specialists. I try to advocate for you if you end up in the hospital. And sometimes people, especially the specialists, don't always communicate with each other as well. I try to push some of those issues and get you out of there as fast as we can, as long as everything is arranged and you're ready to go. And then once you get back home, you come in, you do a visit, and I make sure all of your follow-up is in place so that we don't have issues with that falling through the cracks as well. I have a lot of resources in the community for things like home health care, physical therapy, to help you optimize your overall health and get you back onto your overall road to wellness. So, and then I think the last bullet point about personalization is pretty much a lot of what we've already discussed, is that each individual person is an individual patient. There are guidelines that help drive a care plan, but it doesn't necessarily mean that those are the right absolutes for you. So I try to look at each patient, and with that patient as a team, make a plan that's going to work for you to optimize your lifetime, your lifespan, and your healthiness, and how much you can still love and enjoy life.
Well, that is one of the things that really drove me to come and want to work for Welcome MD. And I'll share a personal experience, because I know Dr. McVen is very modest, but when she talks about the impact that she can have on a patient, for instance, one that's hospitalized, I mentioned earlier that it was a very personal experience that brought me to concierge medicine. And this was before Dr. McVen was with our practice, but my father was hospitalized. It was in Florida, but it was not in Naples. He had a hospitalist, a surgeon, and an oncologist. And the only one that communicated with my family was the concierge doctor. And he helped my mom and my brothers and I to make some decisions when my dad really wasn't in a position that he could, or even my mom, because of her emotional state. So he really advocated for my dad. He had peace of mind for my brothers and myself. And I firmly believe that my dad would not have survived that experience if it wasn't for the advocacy that his concierge doctor provided. And then he went on to provide that coordination of care when my dad was discharged, and improve the quality of life for my dad for 15 more years past that experience. So I think that just shows the kind of value and impact that a concierge doctor can have for a patient and for the family. So we're very lucky that we have a doctor like Dr. McVen who can do that kind of really not only the medical care, but the compassionate care and the passion for her patients.
Thank you.
So Siobhan, Have we got any questions coming in? Because we really like these programs to be very participative.
We've gotten a couple. Let me see. We've got a question that's asking about signing up the entire family. They want to know if concierge is specific to people with specialized care needs, or if like you can sign up your kids.
You can. Dr. McVeigh, what is we don't carry vaccines in the office. What is the youngest that you're comfortable caring for, Dr. McVeigh?
Well, the youngest I'm comfortable caring for is 6 months. However, in the office, we're kind of aiming for 5 and over, just because 5 and under, there's such a heavy schedule of vaccinations that are recommended. So there's that aspect of it. But I am board certified family practice, which means in residency and in my first year and a half of practice, I saw patients from the day they were born to the day they left us. So.
We have another question asking, like, what kind of access would a patient have if they called your cell on a Saturday or over the weekend?
So once you become a member, you get my cell phone. So you have 24/7 access to me. I usually respond either immediately or within 20 minutes, absolute worst case scenario, an hour for some reason. As soon as I became a member of this practice, I actually reactivated my iWatch, which I had taken off for a few years. So it is connected with my work phone. So messages do come through to me, even if I'm in the pool or gardening.
Great. Someone says that they're trying to convince their mom to sign up. And so they wanted to be able to take away some bullet points that they could tell her to help her decide. I guess she's on a lot of meds and transportation is an issue, but it's getting hard for them to manage her care by themselves.
Do you want to take that, or do you want me to take that, Dr. McVeigh?
Can you start that one?
I will. So, you know what I would like to do? If you'd like, I can follow up with you and we can have a conversation about specific issues that are relevant to your mom. And then I would send you an email with all of the benefits that are pertinent to your mom and all the factors and features of our practice, and also Dr. McVeigh's bio information. And that way you'll have it in black and white, and then you can also pass that on to your mother. But simply put, I would say that she would have 24/7 access to the doctor, that she can get same day, next day sick visits, that she's going to have little to no wait time. So if somebody's helping get her to and from an office visit, it's going to be a lot easier to coordinate it if you're only going to coordinate it for the time that you're in with the doctor, as opposed to scheduling it for an hour waiting in the office for 7 minutes with the doctor. And that's going to make a big difference. If you don't have to have all this time blocked, that's wasted time, it's going to make it more convenient for the family member, but also a lot more flexible for your mom for when she can see the doctor. And basically just focus on that advocacy that we're going to provide your mom, but also your mom cares about the impact she's having on her family, knowing that this is giving you peace of mind, that you care about her, and that the reason to do this is that the whole family is going to benefit. But I can definitely follow up with a bullet point email for you that's official from our company so that she can see it all in black and white and know that she's going to get these things. And that kind of gives them a comfort level to see it is something that's a guarantee.
So I would just add to that, in the past, and we do offer home visits on a very limited basis, depending on where you live and the circumstances around it. It's something that, could be discussed, but as you know, with traffic in Naples, for me to do that, it can take up to 2 to 3.5 hours. So there's a lot of variables with that.
actually, I forgot to mention one of the most important things that we do if you've got a parent that isn't quite there yet, but you think would be a benefit, or for any of the patients that are interested in our practice, is that we do arrange for complimentary, no obligation consultations. And what this is it's a 30-minute visit with Dr. McVen to talk about her practice philosophy, what your goals are, and if we're a good fit for the practice. As I mentioned earlier, we'd like our doctors to just focus on clinical care. So the membership questions I could answer ahead of time. And that way you can just spend the time with Dr. McVen to talk about the things that she does best. It's not a clinical visit, but it's a great way to see if Dr. McVen is the right fit for you. And all that takes is a reaching out to me at either my phone or an email, and I'm more than happy to coordinate that for you.
So someone saw the article, Dr. McVen, that you did on statins, and they wanted to know why statins are so controversial.
Well, the main reason why they're so controversial is the fact that they're so overprescribed. It goes back to the whole idea that every single medication you put into your body, and even supplements to a certain degree, you're going to have the potential for side effects and interactions with your other medication. So if you don't need the medication, you don't want to add those additional toxins into your body. Now, if you're somebody with the risk factors where you do need those medications, then of course I'm going to recommend them. But my philosophy is to try to get you as healthy and vibrant with as least amount of medications as possible. Sometimes that means reviewing your history and determining if you really need that medication, or if potentially it was overprescribed on an old guideline or an old understanding of what would be how we refer to as preventative, when in reality, there might be better options as a prevention.
And we did have somebody ask about like if OBGYN exams were included, and obviously they are, and I know that one, but I thought that might be a good opportunity. You have like a long list of procedures that you're able to do at the office that I didn't know if you wanted to recover.
We could definitely. Part of that is it's a long list. So part of my background is urgent care, well, family practice in a rural setting and urgent care. So quite often I would be bridging care where someone might not be able to get into an orthopedic or a dermatologist as quickly as they would like. So I'm pretty fairly well experienced in incision and drainage of abscesses, removal of suspicious lesions, precancerous lesions, biopsying those lesions, small non-melanoma type ones, I do remove those on occasion, removal of ganglion cysts, joint injections, shoulders, knees, elbows, hips. I don't do the back, the hands or the feet, just because those are very small spaces, which really should be ultrasound guided. And we clean out ears, so that saves you a trip to the audiologist. There's a lot, pap smears. Trying to think, is there anything on the list I wrote down that I didn't mention?
No, I think I'm trying to remember what we covered when we were putting together your bio sheet, but I think the point's just to list that, there's definitely a lot of things that you cover that can save them a trip to another specialist, because you could do it right there.
Lacerations.
Yeah.
So if you're able to call and get in, which obviously 99% of the time within 24 hours, I can repair most significant lacerations. Anything as down as deeply as to the muscle, no, that would be the emergency room. But anything else, I used to do pretty nasty ones at least once a week. So
we have one last one, and it was just specific to the Naples market. What are you seeing as some of your biggest challenges with health, the population's health overall? Probably
age.
Okay.
You know, the aging process, understanding the aging process, and just trying to work with patients to change diet and lifestyle modifications and to really invest in their own health so that when they do make it to 90, 94, you know, they're up and moving and spry and with as little pain as possible.
Those are all the questions that have come in today. So Tara, did we have anything else that we needed to share with anybody? I see we've left them with your contact information. And like I said, if anyone dropped off, we can follow up with a copy of this recording, whether you dropped off or whether you stayed till the end.
No, I just want to thank Dr. McVeigh for taking time away from her patients to be with us. I appreciate that. And Siobhan for all that you did to organize this. And most importantly, to those of you who joined us today, please feel free to reach out to me. Please feel free to let your friends and family, if you think we can assist them, to reach out to me. And I'd be more than happy to set up that complimentary consultation with Dr. McVeigh. And I hope that everybody has a happy and healthy day.
All right. Thank you so much, Dr. McVeigh. Thank you, Tara.
Thank you.
This was
Thank
very
you.
informative. Thank you,
Everyone
everyone.
who came.
Yeah.
So, thank you.
Bye.
Bye.